good morning, depending on where you might be. My name is Kirby Morgan, and I am a child fatality prevention specialist with Florida's Department of Children and Families. That's the child abuse section. Um, what my job is, I provide oversight and expertise when it comes to a child under the age of 18 who has passed away, and there is some form of suspicion of abuse or neglect in reference to that child's death. It is reviewed at the 1-800-96-ABUSE centralized hotline that Florida has. And if it meets statutory requirement, it is then accepted for an investigation. And I provide oversight on it from the program office side of things, ensuring that the case is done properly, as well as I have to write a report after each case is finalized. And then the case is eventually sent to the local and state child abuse death review teams.
Great. Thank you for that. So you're also involved in the state plan that's being developed for the state of Florida. What is your involvement in that?
My involvement in that is I am co-chairing the steering committee to develop Florida's water safety strategy at the direction of the U.S. National Water Safety Action Plan. I became aware of the U.S. plan about 4 months before it was launched, when I was presenting in Colorado at the National Water Safety Conference. One of the individuals by the name of Greg Field out of Michigan was a part of the one of the components of the creation of the national plan. He made me aware of what was going on. We then had several different meetings, which gave me the opportunity to be involved in June of 2023 when the plan was launched. And I've been on all of the webinars and been involved on a national level since then. And it's given me the opportunity to work professionally with the individuals that were a part of the creation of the U.S. national plan to assist and guide in reference to getting the steering committee here together in the state of Florida. And then now to the point where we're starting to branch out as at the direction of the Reflection to Action, which was put out by the U.S. national plan, to where we're going to have an in-person meeting on May 28th to put a draft plan in front of everybody and say, by the way, what looks good, what do we need to tweak, etc.
Great. That's exciting.
I'm looking forward to it. I'm looking forward to it because sadly, I can report that Florida's DCF already has 20 drownings reported to us for investigation already this year. And we are headed, I've done a lot of data research on Florida's DCF drowning data going all the way back to 2009. So I have charts and graphs in various different ways, shapes, and forms. And one of them was I broke the drownings down by month. And we were about to ascend the bell curve because we're heading towards summer months. And the numbers always go up during the summer months here in Florida.
Yeah. So if we're looking at data, if from the standpoint of folks that might be in a state and they've never necessarily been able to find or trying to figure out how to find data sources within their state, what kinds of data sources are available in the state of Florida from the perspective of drowning prevention and water safety?
Drowning prevention and water safety. There are two main sources in the state of Florida. There is the state of Florida Department of Children and Families Child Fatality Prevention website that was launched at the direction of a Senate bill back in 2014, so 11 years ago. And it provides easy access to statewide data as well as local data, where they can look at trends and they can look at all of the various different causal factors that come into play when a child has passed away, one of them being drowning. And they can identify location as well as a narrative in reference to what occurred, the age of the child. All of sensitive, the HIPAA information, of course, is not there. It's all generic to avoid violating HIPAA. And so you can access it there, but then you can also narrow it down to whichever one of the 67 counties that Florida has. You can narrow it down and search whatever you are looking for in reference to, be it a hotspot, be it a trend, etc. There are other data points on there that can also be researched. And then the secondary data source would be the Florida's Department of Health. They have a website called Florida Charts. The first time I tried to go on there, you kind of need some guidance from somebody that works within the Department of Health. But once you have that, you can then access a multitude of data when it comes to researching various causal factors when it comes to how children have passed away. And I say that it's a bit challenging because their phrasing and terminology can be different than what you would think. And then you would know what to do. And the first time I got walked through it, I had to get together with an injury epidemiologist that works for the Department of Health to say, by the way. But that's what I would, this is what Florida has. Now, of course, I don't know what the other 49 states have. I do know that Texas has a similar website to Florida's DCF, where they track their drownings in real time, just like we do. But I know that from my involvement on a national level at the National Water Safety Conferences, that I sat through a presentation back in 2023 with the Consumer Product Safety Commission, who runs poolsafely.gov. And somebody in the audience said, well, why is your data 2018 and 2019? And they went on to explain that trying to obtain the data from a national level with all of the various different states can be challenging. And I'm in the back of the room raising my hand going, Florida's got data in real time. And they're like, we want to talk to you. And I said, don't worry, I want to talk to you too. So that's kind of, finding myself working with individuals on a national level has made me, realize that Florida does have some advantages in reference to data collection.
So you've mentioned two primary sources. What kinds of data? Is it simply the drowning mortality data, or is there non-fatal information as well that's available?
On the DCF, it's solely those that are reported to us for investigation. So it's the fatality data. Through my work with Florida's Department of Health and a couple of the injury epidemiologists that are based out of Tallahassee, that are our state capital, not city capital, our state capital, they are able to extract additional data points, all right, outside of DCF's data, because DCF, we don't investigate every single child fatality from drowning under the age of 18. The prime example of what we wouldn't be involved in would be a 16 or a 17-year-old that has their own vehicle, drives themselves to the beach, or drives themselves to a lake, all right, and they suffer a fatal drowning incident. There is no parent caregiver situation present. So we would not statutorily need to be involved. There would be no justification for DCF to be investigated. But under the Florida charts with DOH, we can extract the vital statistics data, where we've gone so far as to pull it with no age restriction. So from 0 all the way up to 85, 90 years old, we've been able to extract the numbers. And Florida actually averages about 500 drownings per year, with the cause of death being drowning. One of the other things that I've also been able to do is, under the age of 18, we pulled through Florida charts, we were able to pull the numbers for 0 to 17 to be able to show that, yes, DCF does not investigate everything. But one of the things that they've also been able to do is extract ER and hospitalization data to show us, and I put a graph together showing DCF's numbers, the 0 to 17 from Florida charts, the no age restriction from Florida charts, and then the ER and hospitalization data as well, showing the graph lines and saying this is really important. And with the ER and hospitalization data, they can only do that back to 2016, because there was a change in the ICD coding in reference to how things were tracked. And so it would have skewed the data to go back further. But it's still incredibly important to be able to show the graph lines with that, because in that 2016 to 2023, there were somewhere between 5 to 6,000 hospitalization or no ER visits
Okay.
just over that time period. So it's a much larger number. Last year, Florida, DCF got the highest number I have ever seen. And I have data going all the way back to beyond 2009. We received 105 drownings last year. And that was more than Texas. They got 103. So the rates, working with the injury epidemiologist has been phenomenal for me, Tina, because my brain just can't wrap itself around rates of this many per 100,000.
Right.
It just give me the raw data, give me the numbers that I can put my hands on. But this is why I turn to the EPIs to go, can you put this into rates for me to help me, and to help those that are looking at this understand it a little bit better?
So how would someone who is just trying to get data, so they're trying to pull together their state plan or their local plan, and they can find these resources, right? And so they can pull down all kinds of information, but then how do they get connected with someone who can interpret that data for them?
Wow, that's a good question. Because I
Is it a
started off,
networking kind of?
it's yes, exactly. It's a networking thing, which this past February's National Water Safety Conference, I felt, to go old school with terminology here, I felt like I was the Tasmanian devil while I was at the national conference, because every time I turned around, I was talking to somebody else, I was networking and developing those relationships. And that's been key for me in reference to bringing the individuals in that can guide us. Because when I first started trying to pull the steering committee together at the end of 2023 here in Florida, I invited Morag. I invited the then president of the National Drowning Prevention Alliance, Adam Kaczmarchian, because they both had the experience to be able to guide us. Now I can turn. I can turn to Alyssa Magram, who's the current interim director of the NDPA. If I have questions, I can still reach out to Morag with Safe Kids Worldwide. I can reach out to you. And so my recommendation would be to talk to people, look for people that might have the knowledge. And the starting point for somebody, if they don't happen to be with their resident child welfare agency, or they don't happen to be with the Department of Health, reach out to them, because more than likely there will be some form of child abuse death review, which reviews all of the cases that are reported for investigation. And that's the way it handles here in Florida. But I know it's a national thing, because there's the form that our local and state child abuse death reviews. There's a national form, the National Child Fatality Review Board. I can't remember the specific
Yep.
breakdown, but the form is national. It's like 20 plus pages long. And so whichever state you're in, see who does that and reach out to them, and that begin the networking process. Because if you're not with those agencies, it could be challenging. I had the benefit of being within DCF. So not only is there the public facing website that we can access, I actually have access to the internal Excel spreadsheet that populates to the state website. And a regular person cannot access that. And the reason why is because there's HIPAA protected information in there. Children's names,
Right.
dates of birth, dates of death, etc. So there's protected information. I have access to it though, but whenever I put my data together, I just make sure that it's generic and no HIPAA related information. But it could be challenging for somebody who doesn't know this, but that's what I would recommend.
Yes, that was going to be my next question, is having the inner workings, right? What are the other sources that are maybe behind the scenes and not necessarily publicly available, that someone, if they had the right connections or asked the right people and had the right questions, that they could potentially access?
What I just explained to you about DCS internal workings, pretty
Yeah.
much the same thing applies with the Department of Health,
Okay.
because they have the internal side of their working systems that then generates to Florida charts. So they have access to the data that's protected health information. So developing relationships with those two entities would hopefully be able to push your whichever state you may be in, the development of your strategy. I've also done my best to try to network with the other states that are at the top of the list when we don't want to be at the top of the list for highest rates of pediatric drownings. And that's Florida, Texas, along with Arizona and California. And I've tried to develop relationships. And of course, now we had the hurricanes last fall that, as you know, we've had this discussion that kind of put things on hold for a little while. The last meeting I actually had with those 4 individuals, I think, was at the end of July, right before we started to get very busy with the hurricanes. And I need to reestablish that, because what I'm trying to do is working with the same type of entities that I am in those 3 other states to see what they do. And especially California, because they already have their plan written and established. So if they've developed something that we can use here in Florida, we're not going to reinvent the wheel. We're just going to borrow from them and give them credit eventually. But that's one of the things. If there's other states out there, like in the Midwest, that don't have the amount, like in Nebraska, Oklahoma, that if somebody like that is in the process of trying to develop there, they have to guide their strategy in reference to what their environment is. To give you an idea what I mean by that, the national plan, I believe, has 7 working groups, or had 7 working groups. In Florida, we have 9 as of right now, because we have different circumstances that led us to create additional working groups because of the tourism factor and because we have so much water here, and attacking all sides, because we have 825 miles of usable coastline. And then there's 30,000 rivers, 26,000 miles of lakes. It's a lot of water. So develop your plan, reach out to your individuals, network, etc. The individuals that, excuse me, have access to that protected data should be willing to work with you, as long as the understanding is that there's certain information that they won't be able to provide.
Right. Have you, in the process of all of this, have you looked at the national data sources like Whispers and Wonder? Have you used them at all, or have you stayed really local with the data coming out of Florida?
The data coming out of Florida, because of the access that I have between myself and the Department of DCF and the Department of Health, I've stayed within. I haven't done anything on a national level, because I'm in the sense of using their information on reporting here. It usually kind of works in reverse, where if there's somebody outside the state, and I've been involved on a national level, probably going back to 2022 now. And so if there's somebody outside, like yourself, if they've got questions about data in Florida, I'm kind of the person they're reaching out to now, because of my involvement and becoming exposed to individuals by networking and developing relationships. They come to me to ask me about Florida's data. I do try to work with the CDC. There's a certain research scientist. I hope she's still there. Tessa Clemens. I've sat through several of her presentations, as well as when I've been working on my data. It's not that I've been trying to access it on a national level, but I've reached out to individuals such as Tessa, such as Dr. Julie Gilchrist, who had been working with the NDPA and had been previously employed with the CDC herself, and Morag Mackay with Safe Kids Worldwide. I reached out to them to say, well, okay, how do I proceed here? What's the best way to analyze this data? And so it's not that I haven't been reaching outside, Tina. It's just that I've been reaching out to get guidance in reference to how to go about putting the data together.
Right. So with that, what kinds of things are you looking at or for when you're trying to establish trends in the data? so that you can make those educated decisions on what your strategy needs to be.
Wow. Okay. Multiple different aspects that I've analyzed and continue to analyze. And I'm looking off at one of my side
Sure.
monitors where my main spreadsheet is. Um, I'm tracking not only the number of drowning, I'm tracking the ages. I am tracking gender. I am tracking the body of water, the location. And here in Florida, it's mainly residential pools. We've got the most residential pools by the data that I found a year ago, January. At that point, almost a year and 4 months ago, they estimated we had 1.6 million residential pools. And so by now, the way we knock things down and pave it over, we've got to be closing in somewhere between 1.8 to 2 million residential pools. But I track that. I'm also tracking whether or not the parents state if the child is autistic or not, because autistic children are 160 times more likely to suffer a fatal drowning incident. I'm tracking it by region because here in Florida, with the 67 counties that I mentioned, DCF, we have 6 regions that are broken up according to judicial circuits. So we have 20 circuits, 6 regions, and I'm tracking it by region. And my region in the center part of the state, so you think Orlando and Kissimmee, which is basically Disney, tourism central. We are the focal point. We by far lead the state of Florida when it comes to the number of drownings. I am tracking the difference between children under the age of 4 and children from 4 to 17, because children under the age of 4 are at the highest risk. We average about 80% of the drownings are children under the age of 4. I'm also delving into whether it was active versus non-swim time. And by far, somewhere between 70 to 80% of the drownings occur during non-swim time, to where the family may have been in the backyard, may have been playing in the pool, but they decide it's lunchtime, they decide it's dinner time, but they don't secure access to the body of water. Child slips back outside, toys are still in the pool, silent drowning happens, child falls in. One of the things that I also got a good question on, and then it took me quite a while to break down, was trying to determine what the distraction was on the DCF drownings. And I ended up having to come up with categories because my main, I created a Word document to document every time I ran across a specific situation. It became 5 pages long in Word. Every time I turned around, I kept getting another type of incident that had occurred. So I had to create categories to track the distraction. The main one being lack of supervision. And I even got questioned by somebody in our state capital, Tallahassee, where they were like, aren't they all inadequate supervision? And I'm like, well, technically, yes, but I wanted to break the data down further. So I came up with lack of supervision, inside household activities, outside household activities, sleeping, personal activities, party get-together issues when somebody's having a party at their house, whether a person was working, whether they were distracted by their phone or their computer, whether it was a potential open water issue. So that's helped kind of try to analyze what was going on. As well as the most recent stuff I did residency, I did state or country of origin to determine whether or not they were a Florida resident or whether they were visiting, because we have the tourism factor that plays into. And I've also started to try to track rentals versus non-rentals so that eventually we can identify, because we have neighborhoods in South Orlando in Tourism Central where we've had corporations just buy up subdivisions, and that's all they do is they rent them out. And so I am working on tracking all of this data to be able to assist the individuals that work on proposing legislation. I can't lobby, I'm not allowed to, right. But I've learned enough by now and I've networked enough that all I need to do is say, by the way, here you go. Yeah. Here's the data that's going to be important for you to lobby your local legislators. So I can recommend that as well.
Yeah. And that's the key, right? Is we know that data needs to be available to be able to support all of these things, whether it's building a strategy, whether it's lobbying, whatever it might be. And so that's part of the reason we want to have this discussion. So I guess really the only other question that I have for you is, if somebody is just getting started in this space, right, is not an epidemiologist by any means, where would you recommend that they start? And who would you recommend as a primary source of information that they would reach out to?
You could check to see whether or not your state has an entity that provides water safety and drowning prevention. The example here in Florida would be Water Smart Florida, which is funded by the Department of Health that I mentioned already. They have a public-facing website where information can be obtained in reference to Florida for drowning prevention advice, recommendations, etc. Reach out and determine if your state has something like that. Reach out to the aforementioned Department of Health and or whatever your child welfare agency is. And then also, even down to a more local level, find out whether or not your community has a drowning prevention coalition in place. I've since my scope has grown, because it initially started just with the central part of the state, and then it very quickly expanded to statewide when it comes to the drowning prevention work that I've been doing. I've become a member and or an attending member of some of the main coalitions that we have here in Florida. There's one down in South Florida. There's one down in Southwest Florida. One's in the Miami side. The other one's on the other side, the west side of the state. Those are two of the really, really very, very, very active ones. There's also a Central Florida one, obviously, that I'm a part of. But determine, see what's out there, okay, and then reach out to them and say, listen, is something already ongoing? Is there something I can join in and help, or has this not even been thought of yet?
Well, and I guess I mean you're pretty open and receptive yourself, but would you say that if someone picks up the phone and makes that call to the Department of Health, are they receptive, and what would be the best approach to have that opening conversation?
Oh, wow. The best approach: express your passion about wanting to reduce pediatric drowning and you want to prevent it. There's multiple different aspects. I mentioned the working groups earlier. And two of those I'm a part of with you would be the barriers and the data side of things. The whole barrier thing, and it's a combination of barriers and swim lessons. Swim lessons, we have a voucher program here now in Florida where you can get 8 swimming lessons for a reduced cost. One of the things that I've been wanting to have them make sure that they express to the families when they get these lessons is those 8 lessons are not going to make them a proficient swimmer, that it needs to go beyond that. The barriers, I mentioned, that's one of the things that I'm tracking on purpose to say, by the way, this is needed. God bless. Tina, I can't imagine trying to start at the beginning and at the bottom, because for me, I had the insight of having been the fatality specialist with the state by the time, because drowning prevention has really been a part of this the whole time. Because I've been with the state for 30 years now, and I've been in child abuse 22 of that. 17 of those years have been as the fatality specialist. So I've been actively involved, but it's grown obviously over the last 4 years. To where I'm now trying to create a strategy for a 23 million plus population state. And it's my humorous side says it's like herding cats.
It's no small feat, for sure.
Yes.
So the more we can chip away at this, and really utilize the resources that we have to be able to share information, right? To share information from our existing networks to those who, like you were saying, right? They've never stepped into this space before. It's something that they're passionate about and want to do, but how do I get started? That's always the biggest step, is the first step. And so the more that we can provide them just that, guidance, whether it's an easy conversation or some documentation to be able to help them to take that first step, that I think the better off we're all going to be in the end. So
that just made me think one of the other relationships that is really we've been developing is some of the parents here in Florida that have created foundations in the memory of their child. I mentioned the Zach Foundation earlier. That I cannot recall. Is it Texas? I think somewhere in the Midwest. I think Zach passed away somewhere around 2007, I believe, and their family created a foundation. That foundation has grown to the point where they've assisted other states, which is why they're now helping us here in Florida to
right.
guide us. But I've had parents with the relationships that I developed with the parents that already have foundations established here. A couple of months back, I got a question directed at me from a parent that had lost a child due to drowning, and they were trying to figure out how to go about establishing their own foundation. And because of the networking that I've developed, I immediately turned around and gave them the contact information for the people that I've worked with here in Florida. Team Kareem, there's the Gunnar Martin Foundation. There is Paul DeMello, who is now working with Eric Lupton with Lifesaver Pool Fence. All of them are based here in Florida, and I've interacted with all of them. I've done we've done presentations with Christina. And it leads me back to if you want to recommend somebody, if you want to make an impact, have them go watch the videos that the NDPA with the Close Day War campaign, because two of those I use in my own presentation, which is Casey McGovern, who is now leading Every Child is a Swimmer. I use her videos and I use Christina's. And because it's got the stigma where, oh, they must be a bad parent if they've lost their child to drowning. And that's not the case. And it's a gut punch. And when you hear them talking about it. So that's another recommendation for somebody trying to get into this. Reach out to find out if there's foundations set up in your community for people that have lost lost a child due to drowning, and then they will hopefully be able to point you in the right direction to get things moving.
Great. Any other advice on the data side?
Keep digging.
Great.
I fell down the rabbit hole. What can I say?
It happens. It happens to all of us. So, all right. Well, thank you.
Of course.
Great information. I appreciate your time today.
No problem, Tina. Thank you. I do appreciate it. And I will see you soon.